The Ekiti State Government has appealed to residents to utilize the Ekiti State Emergency Medical Services and Ambulance System for on-the-site treatment and/or rapid transport of illnesses or injuries requiring urgent medical attention. The Commissioner for Health and Human Services, Dr. Oyebanji Filani, said this would ensure prompt treatment of illnesses and injuries, as well as prevent avoidable deaths in homes, workplaces and on the roads. Filani, represented by the Permanent Secretary, Ekiti State Ministry of Health, Mrs. Olusola Gbenga-Igotun, spoke in Ado Ekiti on Thursday during the quarterly meeting of the Ekiti State Emergency Medical Treatment Committee, comprising stakeholders in the healthcare delivery system. The Commissioner said, the state has put in place the Ekiti SEMSAS to offer on-site treatment, pre-hospital, first aid, care and rapid transport for illnesses and injuries requiring urgent medical attention. He added that the ambulance service was not for road accidents alone but for all forms of emergencies, including maternity and domestic cases. The state coordinator, Dr. Olumide Obe, said, SEMSAS is an organization that deals with emergency response in the state. Not only for sick and injured victims, we also cover maternal and neonatal cases. Basically, what we do is rescue. We provide efficient and modern transportation to link the sick, injured or mothers in labor with health facilities. Obe, the Director of Hospital Services and Training at the Ekiti State Ministry of Health, said there was the political will to ensure quality emergency ambulance services in the state, adding that collaboration with stakeholders and the committee was yielding results. The coordinator said, we need an infinite number of ambulances, but what we have done to circumvent this is to use government assets for the people. We have created a network of all ambulances in such a way that our command and control center may be in Ado Ekiti, and we can respond as far as Omuo Ekiti. And even when we fully get on board one of our programs, the Rural Emergency Maternal Transport System, we will be able to deploy tricycle ambulances to the hinterland, to places where vehicles cannot reach, so that our people can be linked to prompt health care in times of need. We have categorized our fleet into the core fleet and the peripheral fleet. All ambulances of general hospitals are on board with us. All ambulances of primary healthcare centers are also on board. We now have a category known as the surge fleet, that is, the vehicular fleet we deploy when our capacity is overwhelmed. Obe, however, advised residents against the stereotype that ambulances were meant for conveying dead bodies, saying, the opposite is the case. Ambulances are for rescue. Vehicles that carry corpses are known as hearses, not ambulances. We rescue sick and injured people and bring them to care. So we need our people to understand this distinction so they will be more tolerant of ambulances and accept to use the service. It is not that we carry dead people. We only carry the sick, injured and women in labor. Obe gave the emergency contact numbers for SEMSAS in the state as 112-0800-060-6606, 0811-111-4622, 0811 111 4633, 0811 111 4644 and 0811 111 4655. According to SEMSAS, our ambulance teams treat and release victims when the case does not require hospitalization, and they also engage in emergency transfers from the scene to the nearest government hospital. The ambulances carry first aid and resuscitation equipment, including but not limited to airways, oxygen, suction machines, nebulizers and sphygmomanometers. Recall that Filani had recently said the Oyebanji administration had prioritized the health needs of Ekiti residents over the past 3 years, resulting in significant investment in the sector. The commissioner had said, across our primary healthcare facilities, the governor has renovated 103 centers over the last 3 years. Not just renovation, but ensuring that all the necessary equipment required to deliver services is provided. We can now boast of facilities with water, 24-hour electricity and the capacity to safely deliver women and ensure babies are well attended to. We also have well-trained staff in each of these facilities. Only recently, we recruited about 150 healthcare workers for our primary healthcare centers, ensuring they have the capacity to deliver necessary care. This increases our competency level at the primary healthcare level and assures continued service delivery. The last administration renovated about 9 general hospitals, and this administration has taken over the rest, including those in Ijesaisu, Ayade, Okamesi, Afan and Alawe. These hospitals have been fully renovated and equipped to provide accurate care. The commissioner added that at the Ekiti State University Teaching Hospital, Ado Ekiti, where extensive work had been done on wards, theaters and equipment, we are presently building a fully equipped 80-bed hospital, which will soon be completed. Quote,